Hello and welcome. My name is Dr. Ngozi Onuoha. I'm a physician and health educator. Welcome to Health for Nigeria. Today, I have an incredible guest. I'm so happy to introduce today Dr. Safiyya Shabazz. Welcome.
Thank you for having me.
Welcome. So, we're going to talk about direct primary care. But first, let me introduce Dr. Safiyya. She is a fellow of the American Academy of Family Physicians and owner of Fountain Medical Associates. This is a hybrid direct primary care practice specializing in the care of the whole person from childhood through adulthood. Her advice for health and long life is based on eating to live and establishing lasting habits that reduce the risk of death and disease. Love it. Welcome.
Thank you. Thank you.
So, I think this is a fantastic topic, direct primary care. It's kind of relatively newish, I would say, and growing, right?
It is. It took me a while, even as a physician, to figure out what it was. I couldn't figure out, like, isn't that what I'm doing already? Providing care directly to patients. So,
Yeah,
yes, it's worth explaining for 2 seconds how it's different from the regular care.
yeah. So basically, I hear about it a lot. I know it's a good concept and it's thriving. In fact,
Mhm.
just the other day, I saw an ad on my Facebook page from Jefferson, actually
Did you?
advertising, yes, direct primary care. I was so surprised. I think they called it personalized medicine. So
Hmm.
tell me, how can patients benefit from direct primary care?
So I think the direct comes from the direct being from the patient to physician and physician to patient, as opposed to how things normally are. There's a third entity involved, which generally is the insurance company. So we have what we call a third party payer system. And while that has its merits because it does help to like spread the risk out when you need some of these advanced
Hold on
expensive
for one
treatments.
second.
Okay.
Hold on. All right. Technical audio issue. So can you just rewind and repeat, please?
Sure. So, when we hear the term direct primary care, the direct refers to direct from the patient to the physician or other healthcare professional, and from the physician to the patient, where normally we have what's called, at least here in the States, we have this third party payer system where there's a third entity that really has the most control right now, and that's the insurance company. So direct primary care takes that entity out of the relationship, and the doctor and patient contract directly with one another for a yearly or monthly fee to provide primary care medical services. And the benefit of that is, one, the cost of primary care really is quite affordable, and most of the cost of insurance doesn't have to do with primary care. In fact, primary care is what holds up the whole financial piece because it's the least expensive way to receive care or provide care. Um, but when I guess an analogy would be if you had your auto insurance and every time you needed to get your oil changed or tires rotated, you put a claim on your auto insurance. Pretty soon, the auto insurance, it would seem like you're paying a lot for those services where it might be better to just pay directly for oil change and tire rotation, routine maintenance of your vehicle. This is paying for routine maintenance of your body and gives you and your healthcare pro- professional, which, I think that it's ideal if that's a physician-led team of healthcare professionals, but by giving them the freedom to, give the advice that they think is best for you, and not necessarily putting first place who's going to pay them, which is usually not the patient directly
Right,
nowadays.
right. So it is like a membership. sort of thing. It's like a membership, right?
Right. And there's
Kind
some technicalities about the use of the term membership, but consider it that you're prepaying for access to medical advice anytime you need it. So in the same way, if you bought a membership to a gym or Lifetime Fitness, I think they might charge 200 or more dollars a month for this really fancy gym, um, and you have access to it. You're not there all the time, but you can go there whenever you want. And with this membership, or when you enroll in one of these services, then you have access to the wealth of knowledge that all of us as physicians have when it comes to health and healthcare.
Okay, that's really good. So tell us about your own direct primary care service. I'm interested in hearing about what you do.
So mine is it's called a hybrid direct primary care practice because I decided for myself it really was important to me to be available to those patients that really need to rely on their government plans. So I do have a limited number of Medicaid and Medicare patients that I care for because I felt like that was important because not everybody has the flexibility to do that. But for most of us who, are working or have insurance through our jobs, then it really is a value proposition where if you want the convenience of being able to access your physician because it allows me, by contracting directly with patients, it frees me up to keep the practice going with a lower number of patients so that I don't have to do the treadmill thing, or what is it, hamster wheel.
I'm
It's
so,
not a treadmill, a hamster wheel where most of us in a regular system, you get paid for just moving as many people as possible through the system, whether that's 15, 20, 30 patients in a day. Then that really is where most of your pay comes from, and that limits the amount of chit-chatting on the phone you might be able to do, or if someone has a quick question, you might with I might, with my wealth of knowledge, be able to quickly answer it, but it's difficult to do that when those aren't the activities that you really get paid for. So when people I don't like to have a transactional relationship with my patients. If they need to come back next week, I want them to come back next week without regard to the cost for coming back next week. Or, if we need to text back and forth, I would like to be able to provide them quick answers without worrying about, the cost of that, either for them or the cost for me of, kind of just freeing out poorly, freeing out poorly, pouring out freely
that's okay.
the information without some way of being paid for it. Because healthcare is such an expensive business. I mean, there's so much just to even be able to hang out your shingle that you do have to have some type of model that works. And I think many people are walking around without access to any kind of health care at all. There are lots of people who don't have any type of insurance.
Right,
Many of them are entrepreneurs. There's a growing entrepreneur movement. And if you purchase healthcare on your own, it's pretty expensive.
right,
And most of my patients currently do have some type of health insurance, but it isn't needed to receive the services that I provide. Most of the healthcare that people need is primary care, and you really couldn't beat that for, my service is $1,200 a year, and to pay a premium to get access to primary care for that price, you really wouldn't be able to do it. Now, obviously, if you have one trip to the hospital, you'll wish you had regular health insurance, but some people have a choice between none and paying for primary care and having access to primary care only, then that's a pretty good value, actually. It's not ideal, but that's a great value because I take good care of my patients. I really do.
yes. Yes, I think this is really good information. You're amazing. You're an amazing physician. And I think the work you're doing is very important because there are tons of people who don't have insurance, and there are lots of people who have jobs. Maybe they work for themselves and they don't have insurance.
Mhm.
And health insurance is quite expensive. And, some people just buy catastrophic care health insurance, which doesn't allow them to attend primary care prevention visits
Right.
and do
Exactly.
routine things. So in your concept, so the $1,200 for the year membership, and then when they come in for appointments, do they still have to pay for those visits?
No,
Okay.
no, it's not transactional.
Hmm.
They get access to whatever care they need from me for a year. So if I set my patients up with an app. I've been using and there are a lot of different services like this. I've been using one called Spruce, which I find is really convenient,
Hmm.
where if patients sign up for the service, they can text me, ask a question. My patients tend to be pretty respectful. It sounds really intimidating for a lot of doctors if you say patients have access 24 hours a day, but when they have access 24 hours a day, they don't have a uncomfortable feeling that they have to make an unnecessary call in the middle of the night in order to reach someone directly. So I have honestly, most of my patients have had the ability to reach me most of the time. I've mostly carried my own call even before I transitioned to direct primary care, and my patients know that I have their back, so they are pretty respectful about in the middle of the night, but they can text if they need me. They can call. They can reach out to my office and talk to my staff. Sometimes, during the day, if you're having regular visits, I would obviously be less responsive to a call or a text message. I'm sure if you were in the exam room with your doctor, you wouldn't want them to be looking at their phone to see
That's
who's
true.
calling. The only excuse that I have is if my children are calling me, then I'll announce that and ask for forgiveness. But other than that, you never know what's happening inside. So I just put the phone to the side. But um, yeah, if you think you are a physician, Dr. Ngozi, so you
Yes,
know so much, and people who know you, they call you all the time for like advice that they would ask their doctor if they could reach them easy, right? But they
that's
ask
true.
you because they ask you because they know you, and they know you could probably get them pointed in the right direction because of your knowledge and experience. So if they had an easy way to do that with their own doctor, I'm sure they would.
Yeah. Yeah. So what you described, Dr. Sophia, is more like a community. It's like a village because,
It is.
yeah, it's a village because you have a cap, isn't it? You don't have an infinite number of people that you can bring onto your practice, isn't it? You have a cap. And
Right,
once you reach that cap, you're really not taking any more patients on board because it's like serving a small village, right?
right.
So it's personalized medicine, isn't it? Because the patients, I think, knowing that they have access to you 24/7, I think they might be a little bit considerate
Mhm.
of you and of your time.
That's what I
And the
found.
fact that they have easy access, so they know, oh, yeah, I can call my doctor anytime.
Right.
And that is the freedom in healthcare that direct primary care brings. So the other question I have is more like, okay, so if someone is interested in being your patient and they pay the membership fees, so how about things like blood work and tests, or do you see people who also have insurance and then maybe the insurance, if they have insurance and the insurance covers for testing, and if they have to go
Right.
see specialists, what happens then?
Right now, most of the people who are enrolled in my service do have health insurance, so their health insurance picks up those labs, et cetera. But we've also contracted directly with the lab for discounted prices, and you'd be amazed at how little it costs for basic labs when you're paying the contracted fee. So for most studies. Typical routine labs you can get definitely for less than $100. Like a metabolic panel is only $7 or something in that range, where it sounds daunting when you get the bills, when the way that the charges go out to insurance, and they hustle down the price. And that's why that happens. It's really a perverse system where the doctor's offices, the lab, or even the hospital, the prices are really inflated because the insurance companies are going to chop the price down by
Mhm.
so much. They inflate the price so that they can come to settle at a reasonable price for what was done. But I think there's actually laws where they have to charge you the same price. So you get a bill that's twice as much as the lab or doctor's office would ever really expect to receive from the insurance company, but they've got to charge you the same price that they would charge insurance companies. So it just ends up being like a bad cycle.
Yeah,
um, so when you just pay the discounted fee, it just works out to be a lot less expensive.
yeah,
And you mentioned something else too about like the catastrophic plans, like the high
right.
deductible plans. My family chose that a number of years back because my daughter had an injury that landed her in the children's hospital for a couple of days. And it was around the time when we were doing open enrollment. And normally we would just, pick the most expensive plan. Like we're not going to cut corners when it comes to healthcare. But that year, I said to my husband, who happens to work in the financial industry, and I said, wait a minute, let's actually do the math to see how much would it have cost us if we had the high deductible plan and still ended up in the hospital where you definitely are going to reach the maximum amount of the deductible. And when we did the math, it still would have been less expensive for us to pay a lower premium and just pay out of pocket for the things that we ended up needing for that year. So that's something that many people can look into, where you might then get to be able to choose, well, instead of paying an extra $2,000 a year on this premium, I can get in this lower cost plan and I can decide to spend, out of pocket on my primary care because that's where I go most of the time anyway. So it's a different way of looking at things. I don't think most people really understand their options when it comes to health insurance. It's pretty cut and dry. If you have no health insurance, versus having excess, then people understand that a little bit easier. But even people who have insurance find that they're paying so much for care they may not ever use and still have to pay every time they use it. So,
Yeah, the thing with health insurance, um, it's a very complex, I think, complex decision because there are so many choices. But
mhm,
then if you don't make the right choice, you end up really shortchanging yourself financially.
right,
And the thing with catastrophic health insurance, it's basically health insurance that covers only emergencies. So it doesn't really cover routine care.
right.
And so if you have someone who has chronic medical conditions and they have catastrophic health insurance only and they're not covered, they kind of get stuck with a lot of out-of-pocket expenses. So um, I think we can really sit and talk about health insurance for 2 hours,
Right.
and we still won't have a good solution or recommendation for people. But I think it pretty much depends on their age,
Right.
um, health risk factors, comorbidities, family history.
And
Um,
there
mhm,
are a lot of people who their ability to work is physically
mhm,
is their biggest financial resource. And I,
mhm,
I just had a patient the other day who has diabetes.
mhm,
And, this patient, if they had a period of time where they didn't have access to primary care to manage their diabetes,
mhm.
they wouldn't be able to work because
Right,
their type of employment requires that their diabetes be under control.
right.
So it might seem like an extra expense or something that you don't have time for. But for many people, it's actually the thing behind what allows you to even work.
Right.
So, we have to prioritize our physical selves, like put your own oxygen mask on first, and by redirecting people to their primary care physician instead of urgent care or
Right.
emergency room, then many times you can, make a huge difference in people's health. I think that actually is probably why my patients, in terms of the pandemic, I didn't have any of my patients that I actually treated. I had one patient in my entire practice who succumbed to coronavirus illness and passed away.
So sorry.
But even that patient, I think their family probably didn't realize that they could call me, so they didn't actually reach out. But those are my patients that reached out, and we were able to, even if we needed to send them to the hospital, having access to primary care to be able to even identify, hey, I think you're not doing so well, and maybe before things get too bad, head on over so that you can get some of the treatments, or just even knowledge of the different treatments that were available, whether that was antibody therapy, et cetera. I think that went a long way. Like access to primary care, I believe was a huge risk factor or benefit factor if you had access, in terms of how people fared with the pandemic. So, all of these things are so important, and that relationship that you develop and understanding the individual patient in front of you and what motivates them and what drives them. And sometimes that takes time to develop that relationship. It takes time to teach people about dietary interventions or other lifestyle interventions that can help them to manage their condition. And it's difficult to take that time if we're rushed because we have to get the next person in and out. And with direct primary care, it's a way that people can turn back the clock to their memory of or fantasy of what things really used to be like with that primary care or family doctor relationship. So I value that.
Yeah, so what I'm hearing is from you is prioritizing your health, really adding value to yourself. That's what
Mhm.
I'm hearing. And I think that, back to the issue with insurance, people who have great insurance tend to be employed. And then you find that because they're employed in full-time work, they really don't have the time to take off to actually utilize that insurance. So
Yeah.
you realize when I worked full-time, I had the best insurance. I call it the Mercedes Benz of insurance, but I could not use it because I did not have any time off to go to the doctors.
But
So
wouldn't you have been able to make time to have a telehealth visit or text your doctor if you had a question? You still would have time to do that.
no, no, not
No?
with telehealth wasn't really an option at the time.
It
A lot
it
of
wasn't
it
direct
really
primary
wasn't
care.
right.
It
It
wasn't
wasn't
direct
direct.
primary
No,
care
it
because it
wasn't.
didn't matter what the insurance would pay for. So DPC practices were doing telehealth long before the pandemic.
Yeah, no, it wasn't. It was a regular practice that was very, highly regarded, but really didn't have these services. And half I couldn't use it because they had hours like 9 to 4. And by the
Mm,
time I was done from work, the place was closed. So
right.
I couldn't access anything. And so I was paying premiums. You do pay a little bit. Your employer pays most of it, but you do pay. And I
Mhm.
couldn't access this wonderful and beautiful health insurance that had all the bells and whistles. So of what use
Right,
was it to me? Like, and that's what I find. You see a lot of people that have full-time jobs.
right.
They work 9 to 5 and they cannot access care. You see? So in
I
the
mean, I'm
traditional.
jaded about jobs in general. Of
Mhm.
course, I hope my employees give their all when they are with me, and I want them to be fully engaged. But there is a balance because in the end, most companies are not going to shut down if
No,
your health declines or you fall out dead in the floor.
no.
They're probably not going to shut down just because you fell out dead in the floor. So you have to prioritize. Your family might not be the same. They would really be, changed forever. So we had to start to divvy out our time on the things that really matter. And it could be a difficult balance because you need to work and, as a community, a society, we rely on one another to do our individual jobs well. But people have to stop sacrificing their health.
Yes, I mean, I agree. I've had to tell some people that, look, if your job, you don't have vacation time and you just have to take a day off because,
Right,
health is like money in the bank.
right, right.
Without work, if your health is not right, you cannot be productive. And I think we really need to prioritize our health. I know the people who are listening to this who they haven't gone for their checkups,
You
they
gotta
haven't
do it.
gone for for their vaccines, their routine screenings, they're listening to this. They know they need to take a day off and get their
Right.
health checked. So let's get back to you, Dr. Safiyya. I really have enjoyed this conversation on the direct primary care, and you've explained your hybrid model of direct primary care. And tell me how people can find you.
They can find me online at fountainmedonline.com. And if they are interested in learning more about direct primary care, they can click right on that direct primary care tab where I have, you know, all of the information broken down, maybe too much information. But they can also call us, call over to the office or email us so that they can get a verbal explanation to speak with my office manager and um, decide if it's the right fit for them. And yes, I look forward to hearing from and serving those patients who are interested, or, even if there are people who are interested in a direct primary care practice that is more in their geography, if people are listening from afar, they have gosh, I don't know the website off the top of my head. I think it's called DPC Frontier, where you could look online and find a direct primary care practice near you, and some of them are small, some of them are large, but there you'll find it tends to be a group of doctors who they think outside the box.
Right.
They are not medical robots.
Well,
But
well, having said that, I mean, I just saw, like I said, I saw on my Facebook that Jefferson is offering direct primary care. So that is,
because patients, I guess, because they've seen that it is becoming more popular with patients. I'm not sure how well a large entity like that could um, do the same thing, but I guess it's sort of like Marriott starting to have an Airbnb type service. You
right.
see a good thing and they get on it.
I know. I thought, wow, this is, when I saw that, I thought, okay. So I'm waiting for the other hospitals to jump on. And
The
I
thing is,
guess,
hospitals aren't in the business of like making less money. So
mhm,
I'm not sure how that's going to work out because that's just not how they're set up. They're not set up to keep people out of the hospital. They get paid when people are in the bed.
yeah, they're
So,
probably going to get paid from the ancillary services, because if their
mm,
doctors are ordering the images and blood work and they're going to get done in-house, so that's probably going to be one of the ways they're going to bring in revenue into those
probably.
big octopus hospitals, I call them.
And I mean, sometimes you need an octopus hospital if you get some unusual diagnosis that
Mhm.
only three people in the whole country know what to do about it, then I appreciate it.
Absolutely. I mean, I think we're very fortunate in the area. We have some amazing teaching hospitals.
We
They
really
tend to
do.
buy up a lot of practices around them. So
Right.
that's
Philadelphia
why,
is not a bad place to be sick if you have to be
right.
sick.
It's actually, I mean, we have amazing, I mean, just within a 10-mile radius of the city, you have about five or more solid teaching hospitals, and
Right.
I think this area is blessed in that way. And a lot of doctors actually go through training here. Unfortunately,
Mhm.
most of them don't stay; they head out to better chimes and
I'm Philadelphia born and raised, so I've tried to leave, but so far I have been unsuccessful at staying wherever I went.
So I'm a Philly transplant now. You know, I'm originally from Nigeria, and I get to places in Philly, and they just remind me of home so much.
Oh,
Yeah, I
maybe
mean,
that's why I love it so much.
yeah, because it really has a very home feel. You know, I go into parts of town, I'm like, oh wow, this feels like back home. So, yeah, I've been here 20 years, and I love the city. I've made it my home now.
And
So,
it loves you back.
yes, yes.
That's actually our tagline for the practice, Fountain Medical Associates, the family practice that loves you back.
Yes, yes, yes. So I've really enjoyed having you on here, and I'd like to invite you again, and we'll tackle some more topics in the healthcare space.
Sure.
I've really enjoyed this conversation and learned a lot from it. And I think it has demystified for me direct primary care, because I used to hear about it and it felt really daunting for me because I thought, oh, it's really expensive. Oh no, you know, but now the way you've broken it down, you made it so easy, and I hope that my the viewers, the audience listening, they'll understand it a little bit more. It's really adding a little bit more value to your health.
Yes.
You pay for that little extra service. You know, it's like you go to the Four Seasons Hotel and you want that little extra. Um,
Right.
let's say, can I call it luxury medicine? It's really a little bit extra, right?
Right. Well, I guess primary care, maybe concierge is the Four Seasons hotel. You know,
Yes,
they
yes.
might charge quite a bit more than $1,200
I
for
know.
the year, but maybe in not the Four Seasons, but more like, a Marriott,
Yeah, okay. You pay the Marriott price,
but
but you
not the
get the
Motel
four.
6.
Yeah, you get the Four Season service kind of thing, right? Because you are getting good value. You have
Yes.
access to your doctor. I mean, it's that is like, to me, that is luxury healthcare,
Right.
right?
Right.
Yeah, that's luxury healthcare. So thank you so much. Before we head out, just one more thing from you. One pearl of wisdom. Can you share just one pearl of wisdom with the audience? It can be anything.
Well, I guess I'll share a pearl about one of my favorite medical topics to talk about. When I spoke about this when I was in residency, I gave a presentation and I got slammed by the nutritionist that that was a terrible idea. And now, as the science has evolved, I think she may be more on my side. But I want to send people to go and do a little research about intermittent fasting
Oh,
where people modify their dietary pattern, and it's the closest thing to the fountain of youth that we have. So that would be my little inside tip there about how people can narrow the window every day where they take in food or other calories and learn about how that can benefit your health and possibly minimize the need for medications.
thank you so much for that. It's there was a recent article on intermittent fasting, and one of my podcasts also talks about that. And I think
Yes.
the sort of the nicest one is the 12 hours on, 12 hours off, which makes sense because you're sleeping anyway. So
Right,
that's
right.
it's like a 8p to 8a. You can drink lots of fluids. I did do a podcast on it, so I will put it in the link
Great.
in bio. So thank you so much, Dr.
Thank
Safiyya
you. Until
Shabazz.
next time.
Thank you so much. I really enjoyed this, and I wish you a wonderful rest of your day.
You do the same. Thank you.
Thank you.